Hi, my name is Dr. Arshin Harchandani, and firstly, let me congratulate you on completing your surgical procedure. For an uneventful as well as comfortable healing at home, please listen carefully to the following instructions that I'm about to give you. So the first instruction that you must follow is after the extraction, the doctor or the associate will give you a cotton or a piece of swab to bite down onto. Make sure you apply gentle pressure and hold the gauze in place so that any bleeding that is occurring can be stopped by the pressure effect of this cotton swab. Once the cotton swab is removed and changed, it is not necessary to put another one back and replace it. The second thing to remember is once you go home, please apply ice externally, that is on your cheek or the site of the surgery from the outside for a period of 5 minutes every 15 to 20 minutes. This will reduce any chances of swelling or inflammation that can occur after the first 24 hours. The third thing to do is take your prescribed medication. At our office, we will generally give you a painkiller at the time of discharge. Once your painkiller is taken from the dental clinic, you should start with your antibiotic prescription either before or after the procedure as described to you by us. Please make sure you take your antibiotics and painkillers on time. Do not wait for the pain to set in for the first 24 hours. It is absolutely essential that you be comfortable and pain-free during the first 24 hours of the procedure. For this, timely medication is absolutely essential. The next important thing to remember is please avoid any spitting or gargling after the extraction or the dental implant. This is essential so that the blood clot that is formed gets stabilized and there is no further oozing or bleeding that happens once the clot has formed. Any vigorous spitting or gargling can dislodge the blood clot and you may experience slight ooze of blood or bleeding, and that might scare you. If any such incidences do happen, please feel free to call us and let us know. The next important thing is avoid any strenuous physical activity or exercising for the next few days. This might be important to help in the healing as well as the clot formation process of the wound. Avoid any sort of yoga, pranayam or head movements, especially if you've had dental implants and bone grafting procedures. This should be followed for at least a period of 4 to 7 days, after which you can consult your doctor and ask when you can resume your exercise. The next most important thing is to follow a soft diet regimen. What this means is you should eat foods which do not have any seeds or nuts in them. A lot of oil, spices or food colorants should be absolutely avoided. When you are eating ice creams or milkshakes, please make sure you have an ice cream that is either plain vanilla or plain strawberry. You can have soft fruits like bananas and chikus. You can also have things like oats, upma and idli. These are some recommendations that you can have for the first 24 to 48 hours after your surgical procedure. The next thing that you must follow is perform oral hygiene very gently. Most patients, because of the fear of the wound opening up, do not perform oral hygiene procedures. This should not be done. In most procedures, oral hygiene can be maintained after the first 24 hours have passed. This can be done using a soft toothbrush that can be supplied to you from our dental clinic or be purchased on a medical counter. Sometimes a mouthwash can also be prescribed to you for a short period of time that should be used religiously. A gentle rinsing and a gargling procedure after meals cannot affect the healing and should be performed after every meal to ensure that the wound stays clean and free of any contaminants. Avoid any smoking or alcohol for the first 24 to 48 hours after a dental extraction or an implant surgery has been performed. This is absolutely mandatory. Smoking and alcohol can affect the healing by causing either a dry socket or can cause the wound to open up because of the dehydrating effect of the alcohol. The smoke as well as the heat and the nicotine from the cigarette can also lead to bone not healing as required and eventually leading to bony necrosis. Please, for the first 24 to 48 hours, refrain from any smoking or alcohol and only resume once you have seen your dentist and consulted him for the same. The last but the most important step is follow-up appointment. When you will be discharged from our office, a tentative follow-up appointment will be given to you. If you cannot make for that appointment, please call us and let us know that you will not be able to come. If there is an emergency that needs to be addressed before that appointment, please feel free to call us and reach out to us. Any emergency between the surgical procedure and the follow-up appointment should be attended as early as possible. On the follow-up appointment, the doctor will tell you what food you can resume, what oral hygiene habits can be resumed, and if there are any stitches that need to be removed, they will be removed at the follow-up appointment. So please make sure that you are able to make time and come in for your follow-up appointment. If you follow these instructions, your healing will be smooth and uneventful, and there will be little or no discomfort. For any other queries, please feel free to reach out to us at any time, and we should be available to help you out for the same.